Hello everyone, we are going to start clinical examination stations. There are many clinical examination stations in the exam, MRCS Part B, and you want to know how to deal with them. At least you need to have a certain technique that will guarantee your pass in these stations. Okay, so we are going to start here today with the thyroid gland. Okay. And you want to know that when they about thyroid gland, there are three possibilities. Okay, first of all, they may ask you to examine the neck. Okay, and if they ask you to do that, they will make it challenging because it may be parotid gland, it may be lymph nodes. But you want to know that there are some clues that you want to look for around you in the room. You will find the chair away from the wall there. You will find some signs that will tell you that some points or some clues, as I told you, that will tell you that this is the thyroid station. Okay, and you want to read the scenario well. So the second possibility that they may ask you to examine the thyroid gland. Okay, and if they ask you that, they will make the mission so easy for you, and actually in this case you are going to examine the thyroid gland only. Okay, the third possibility that they may ask you to examine the thyroid, just like that. Okay, and if they say thyroid, this will have two parts. The first part will be you want to examine the gland, and the second part will be that you are going to examine the status, and this is challenging actually. In this case here, we are going to explain to you how to examine the gland and how to examine the status in two different videos, but in this case now I'm going to focus on these, so the thyroid gland or the neck for thyroid. Okay, well, first of all, the first step in any clinical examination station is what is called wiper. Okay, W-I-P-E and R. Okay, so this abbreviation is for the following. Number one, you want to remember all the time to wash your hands, and believe me, you may lose the station if you forget this one. Okay, the second letter I is for introduction of yourself. So introduce yourself to the patient. You are going to tell him that I'm so and so, and I'm one of the candidates for the examination. Okay, so introduce yourself is also very important. The third letter here is the P, and the P here is for the permission, and this is the verbal consent that you are going to take from the patient. Okay, and believe me also, you may lose the station if you forget this part or this P. A here is for the exposure, and you want to expose the part that you want to examine. For example, if you are examining the thyroid gland here, you are going to expose, for example, the neck here and the shoulders, right? Okay, and if you are going to examine the thyroid status or the thyroid gland with this thyroid status, you are going to expose many parts because you are going to examine the whole body, right? And the third part, the fifth part here, fifth letter, is the repositioning. Okay, so most probably when you get to the room and wash your hands, remember to wash your hands before even to say hi or hello to the doctor, to the examiner. This is very important. Okay, so when you get there, you may find the patient lying down. Okay, so you want to ask him, if you are going to examine the thyroid gland, you are going to ask him to sit on a chair away from the wall. All of you know that, but in the examination you are going to forget it, believe me. Okay, so after finishing the wiper, you are going to do the examination according to the known paradigm for you, which includes the inspection. Okay, number one, you are going to do palpation. Okay, and you are going to do percussion. Okay, and you are going to do also, sorry, this number 3, and you are going to do auscultation, right? So here for this station, so for the inspection, you are going to ask the patient to sit on a chair away from the this repositioning, we mentioned it before. You are going to ask him to sit on a chair away from the wall, and you are going first to inspect the lump itself, okay, if there is any. So you are going to see well and focus to know if there is a lump on the thyroid or not. And if it is a thyroid gland examination, there will be a lump, okay. So this is the first point. The second point that you are going to look at on inspection are something called the 6 S's, okay. So what are the 6 S's here? You are going to determine the side as you are looking, okay. You are going to determine the size. For example, it's on the right aspect of the neck, right on the anterior aspect of the neck, at the right to the midline, for example, okay, or at the thyroid area, for example. And you are going to try to estimate the size. Let us say that 2 by 3, for example, and you are going to tell the shape. So you are going to tell the dimensions according to the size, right? So you cannot say it is oval and say that it is 2 by 3, right? It is oval in this way. So you are going to focus on these details. So the fourth thing is symmetry, okay. You are going to mention the symmetry of the swelling itself and the symmetry of the gland also. If you are seeing anything, maybe it's a diffuse swelling, maybe it is only one nodule large. So according to your presentation, there will be the examiner will take a good idea about what's going on, okay. And you are going to mention the overlying skin. Always mention about the overlying skin. Is it dark? Is it reddened? Is there anything abnormal on the skin, overlying skin? And finally, you are going to mention if there are any scars. For example, if this thyroid were operated before, there will be a scar, and that you are going to mention it, okay. So actually these 6 S's are for any lump, okay. Any lump, not only the thyroid gland or thyroid swelling, okay. That is good. So now you are going to, the third step on your inspection, you are going to look at the neck veins, okay. And the neck veins will tell you about if there is any congestion, okay. The face will also be buffy in this status, but you want to comment on this. You want to comment on the neck veins just to complete your inspection in this point here. It will have an importance in other stations, okay. And you want to ask the patient to, now you looked at the lump, you looked at the size, shape, symmetry, overlying skin and scars, and now you looked at the neck and veins. Now you are going to remember that the patient will be sitting in neutral position on the chair. He will not take his head up on extension. He will be neutral, okay, in natural position, okay. So now will come the 2 most important steps here, and these are actually only related to the thyroid gland. This step and the other step, 5th step here. You are going to take a cup of water, and this is one of the clues that by which you can know that this is a thyroid gland examination station. So you will find a cup of water around on the table of the examiner or something like that. If you find this is a thyroid gland examination or thyroid status examination. Anyway, this is a thyroid station. So you are going to ask the patient to take a sip and keep it there on his mouth, and then swallow it when you ask him. Then you ask him swallow, then you can see if that lump on the neck is moving. If it is moving, this is the thyroid gland. The 5th point on inspection is that you are going to ask him to protrude the tongue, okay, this tongue. Please, would you mind if you protrude your tongue, please, for me? And when he does that, actually, if there is any thyroglossal cyst or something like that, or even the gland itself, it will raise up if there is any communication. So these are the most important points that I mentioned here. These are related to thyroid gland. Okay. The second point here is the palpation, and for the palpation you are going to touch the patient and you have to take permission. Okay, you want to take a consent from the patient before touching him. So explain that you are going to examine the neck of the patient. I'm going to examine your patient from behind, because believe me, this is not comfortable. So you want to explain before you start, and this is one of the fatal mistakes that many people fall in. Okay, so remember it, please. Well, number one, now we are going to palpation. So the first step is that you are going to feel the lump. Okay, so you are going to feel the lump with your hands. And what do you feel on the lump? Okay, there are some points that you want to see. You want to check the surface. Okay, is it smooth or not? You are going to check the edge or the edges. Are they diffuse or are they marked, touchable? You can get them there. Okay, and you are going to check the consistency. Okay, so for the consistency you are going to mention that is it hard like your forehead? Is it firm like your the tip of your nose? Is it soft? Is it cystic like this? Okay, and you are going to mention also fixity. You are going to take it with your both fingers, the thumb and the index fingers, and you are going to tell that this is fixed to the underlying structures or not. Okay, and you are going to also add to that the for the fixity. Okay, it is fixity means that the lump is fixed to the underlying structures. There is something called tethering, and tethering is the fixity of the lump to the skin. Okay, you want to mention that also. It is not very important on thyroid, but it will be a good point. And you want to mention pulsatility also, if this lump, sorry, is pulsatile or not. Okay, so this is the most important part in the lump examination. So for any lump, you are going to do surface, edge, consistency, fixity, and tethering, pulsatility. And for any lump, you are going to on inspection see the size, shape, symmetry, overlying skin and scars. Okay, and thyroid gland swelling is a lump. Fine. Well, so now you are going to you finish the lump. You are going to feel below the lump, right? So you are going to feel below the lump, and remember that the patient, you are coming from behind, your hands, both of them are set, the fingers, the volar aspect of the palms and fingers is set on both sides of the trachea to examine the thyroid gland, and you are making palpation by both hands. You fix one hand and you push by the other to know the if there is any abnormality, and after that you get to this point, the lump. If you find the lump while you are doing that, then you are going to examine by 2 or 3 fingers. Okay, well, so now we are going to examine below the lump. Okay, you are going to see if checking below the lump will tell you if it is extended down or not inside the chest, okay, or the thorax. And you are going to examine the trachea. Okay, and for the trachea you are going to check if it is central or not. Okay, well, and as you are putting both palms of your fingers on the thyroid gland, you are going to ask the patient to swallow water again. You are going to give him a cup of water, and you are going to ask him to swallow again. So in the inspection you have seen that by your eyes. Now you want to touch it and confirm the point. Okay, you are going to ask him to protrude the tongue, and as I told you before, these steps are in the inspection, are in the palpation, right? Okay, so protrude your tongue, okay, for me please, and you are going to do everything in a polite way. Well, it is all about attitude to the patient and the examiner. And finally, you are going to examine the lymph nodes, okay. For the lymph nodes, we are going to mention this in detail in another session, but you want to examine the submental group or groups. It is a group here, one group, submandibular lymph nodes, periauricular, post-auricular, occipital, post-cervical, posterior cervical, anterior cervical, and pretracheal and supraclavicular lymph nodes. Okay, so you have at least 8 groups. 8 to 10 actually. We are going to speak to this later, but you are going to examine them within maybe 3 seconds. Okay, you are going to pass in one movement, and most probably you have seen this before. Well, now the third point here is the percussion, and the percussion will be over the sternum. Okay, and this will also tell you, as we mentioned before, that you examine below the trachea, the lump or the thyroid, and now you are going to percuss over the sternum, and if there is dullness, then it is extending down this thyroid gland. Okay, and final point here on the examination is the auscultation. You are going to auscultate for any bruit, and most of these candidates for the exam, including me actually, forget this point. Okay, so don't forget it please to get the full mark. So this is the thyroid gland examination. We are going to check the status in another lecture, and thank you very much.